What are the types of fibroids?
The types of fibroids. So fibroids are classified according to their location. Okay, so there are five. Some people would say five, some people would say four. So I'm going to say there are four main classifications of fibroids. So the first one being within the muscle lining of the uterus. Okay, which is intramural, okay? The next one is, let's say this is the muscle of the uterus, this is the inside of the uterus, and this is the outside of the uterus, okay? So if it's like sort of bulging out onto the inside of the uterus, we'll call that submucosal. Okay, but if it's outside the side, we'll call it subserosal. And then on the subserosal, we have some that would have like maybe a string hanging on, and then it's sort of dangling from the uterus, called pendaculated. Okay, and then the final one is cervical, on the cervix, if there's a fibroid there. Yes.
How are fibroids diagnosed?
Diagnosis of fibroids could be clinical, according to the presentation of the patient and the symptoms that the patient presents with. Diagnosis can also be done with an ultrasound. Okay, hysteroscopy, where they put like a little camera inside and just have a look, yes, or an MRI.
Is there a treatment for fibroids?
Yes, there is treatment for fibroids. So fibroids can be treated medically, they can also be treated surgically. But on the topic of treatment, it has certain factors, okay? For example, the age of the patient, okay? So if the patient is in her mid to late 40s, we don't really want to treat them because fibroids respond to hormones, and as they're approaching menopause, the fibroids will shrink off, yes. If the woman wants to have children again, okay, let's say she's already had 3 children and she has fibroids, the type of treatment that we'll give to that woman, as opposed to somebody who's never had children before, would be different. So we also look at the symptoms that the patient is presenting with. If the patient has severe symptoms, our treatment might be a little bit different. We also look at the size and the location of the fibroids before we treat them. So our aim is first, in the initial stages when we find that the patient has fibroids, especially if they're asymptomatic, meaning they don't have any symptoms, we just want to observe them, okay? Then we'll move up from observation to medical management, depending on how the patient is presenting. Then from medical management, we'll go to surgical management and other management.